subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. I'm delighted to have here with us Dr. Shail Jaggi, a leading dental surgeon based in Pune. A little about Dr. Jaggi. Dr. Jaggi is a certified MicroEndodontist, and I'm going to ask her more about it later. A certified MicroEndodontist with specializations in endodontics, aesthetic, and restorative dentistry. She is a certified Nobel Fellow by the Nobel Biocare Implant Systems. She has undergone extensive training in the use of Dental Operating Microscope for Advanced Endodontic Procedures like Instrument Retrieval with Dr. Yoshi Terayuchi. She's passionate about cosmetic dentistry and smile designing. She has trained and is also certified in digital smile designing with Dr.Christian, Coachman, founder and director of Dentalwiz, an advanced specialty practice dealing with advanced endodontic, restorative, and implant surgical procedures. Smile by Shail is a dedicated smile design center for advanced cosmetic dentistry procedures, and Dentalwiz Dental Training is a dedicated training center which is set up to train from the most basic to advanced procedures, including restorative dentistry, endodontics, cosmetic dentistry, and magnification in dentistry. She devotes most of her practice time to this field of advanced endodontic techniques, reconstruction of badly broken down teeth, advanced restorative procedures, cosmetic dentistry, endodontic retreatment, instrument retrieval, and smile makeovers to make her patients look and feel great. A recipient of various awards, she has been using the microscope as a teaching aid and thereby making it simpler for young dentists to appreciate the finer aspects of dentistry. A speaker and key opinion leader for Coachman and 3M, she keeps herself inspired to train and teach younger dentists for the best dental practices. Today we have Dr. Jaggi talking about dental care for seniors. Don't let your teeth get vintage, is what she says. And I made a small request to her to share with us some tips, tricks, and traps. Welcome to Health Live at Seniors Today, Dr. Jaggi. How have you been?
Very well. Thank you so much, Pradyuman. It's thank you for giving me an opportunity to interact with a lot of senior citizens who I think are getting younger by the day. So yeah, it's a pleasure. Thank you.
Absolutely. Dr. Jaggi, I must ask you this. We have seen over the last 2.5 years the worst of times as far as COVID is concerned. And now it's kind of springing back, the fourth wave or whatever one might call it. How are you as a dental surgeon keeping bracing yourself for the unknown, if I might say?
So actually, with COVID, very frankly, we didn't shut office for a single day. We worked through COVID. We were shut only for about 15 days when they announced the lockdown. But I think that was the 28th of March. And then 15th April onwards, our office is not being shut for a single day. So when it comes to bracing ourselves, we've been bracing ourselves from day one. And through COVID, we've seen a lot of emergencies, and we have actually helped a lot of people get through COVID happily, COVID-free, and without any restrictions. So it's been good.
That's amazing. That's amazing. But you are in a city which perhaps declared the lockdown before the rest of the world did, right?
Yes. Yeah.
And the fact that it's been there, it's the fact that you've been up and about, except for those 15 days, is very good. But tell me honestly, dental work, when it has to happen, you need immediate solutions.
Absolutely.
And how does one manage in these COVID times if one perhaps has got COVID and also has some pain in the tooth? What does one do?
So very frankly, we work really close. The oral environment is the closest, is the worst that it can get for COVID, right? So if the patient has COVID and they need dental work, then I think pain management and medication control is what we do. When they come back with a negative report, then to like a quick brief about how we handle, we are completely up to date with everything we need in case of like gears, a lot of humidifiers, a lot of things that are cleaning out our environment. We've got multiple operatories, so we work consecutively in each operatory, and then we fumigate each operatory. So we have all the protocols in place, which makes it very easy and instills confidence in the patient to come in and get their work done without having to worry about going back with COVID or something like that. So in those terms, yeah, we are very sorted with all our protocols. And we actually have a link, and we have it up on our Instagram page and on our Facebook page. So anybody who's interested can just go to these places and look us up, and they will be follow. So yeah, it has been a challenge, but then we've used that whole year to gear up our staff with the new protocols and new techniques and everything else. So now we're in the flow. It's never difficult because we do it like any other routine day, only we're doing a lot more effortlessly because we've trained so much for it.
Tell me something. This is away from a medical issue, but it concerns us all. Obviously, a host of these things that you're doing to stay safe means a lot of more costs that one has to incur. So does that mean that medical care also has become more expensive for the patient?
So again, that's actually a very good question, because a lot of my patients came back saying that, oh, we went to somebody who was closer, and then they asked us to pay for the PPE kits, and they asked us to pay for XYZ. And but no, because we have so many people, and we've been working for almost about 28 years, and we have a dedicated lot of people who keep coming back to us. We've just absorbed the cost, and we don't transfer any cost to them. Also, we started working on solutions that are more eco-friendly. Like a lot of people started using a lot of disposable stuff, which we did for the first 1 month, and we realized we were just getting so much disposable stuff. It was really not eco-friendly. So we got into doing like cotton gowns and things like that, which were just as good, better. And the additional thing we did was we installed a washing machine in our office. So nothing was going back home. Everything was on the premises. Things happened, they got autoclaved, they got sterilized, and they came back into office, and we didn't generate any waste at all. So in those terms, it also became easier for us to absorb the cost. So yeah, if people are saying it's getting expensive, that's just because I think at some level they're using it as a way to make it more expensive for the patient. But actually it can be done in an almost inexpensive way if they follow the right way to do it.
The washing machine in your clinic, amazing.
Yeah.
Amazing that is there. I do know of one patient who would for a while travel long distance to come to you. So I guess there are people who have you have your following. Great, Dr. Jaggi. So let us have your presentation, and after that, those of you who have questions, please put them in the Q&A tab as always, and do make a mention of your age and gender, so that Dr. Jaggi could give you a considered reply. Over to you, Dr. Jaggi. We have allowed you to share screen.
All right. So, like Pradyuman just introduced me in this really big, fancy way, but actually, in a really precise way, I focus on saving teeth. I'm a restorative dentist. I'm an endodontist, which basically means I'm a root canal specialist. And I love aesthetic work. That's one of the prime things that I do in my office. And funnily, strangely, or just call it coincidence, I do see a lot of senior people in my office. And very frankly, senior people, a lot of people say, oh, they're geriatrics or they're very difficult to handle. But trust me, the senior lot of people is my favorite lot of people, because I think they are so phenomenal. So as we go along, I'm going to share a couple of stories. I'm like a storyteller, a dentist and a storyteller. So over the last 28, 30 years, I have so many stories to tell about so many people. So it's a lot of fun. So let's just get on with it. And if you have a question, I will answer it in a bit. So the objective of today's discussion is to recognize and relieve oral health issues, typically with the senior lot of people, to restore and to preserve function, ideal health and function of the oral cavity for optimal well-being and health. And I say optimal health, well-being and health, because I realize that sometimes a lot of senior patients I see just take their teeth for granted, or they think it's not worth it to take care of their teeth, or I don't know, it's a mindset. So that's something we're going to change today. Mindset has to change. You need to be doing everything you need to do to live that really optimal and a happy life for your everyday existence. and care of soft tissues. So I'm going to start with something called dental challenges for senior patients. Now, before I even start with dental challenges for senior patients, I want you to look at a couple of things that I want to show you. Look at this. Senior patients, my golfing partners are in the range of 80, 85, 76, 82. And these are people who play more routinely than I do. They have a fantastic life. And those are my two senior citizen golfing partners who were with me when I had my hole-in-one. So if we're talking about dental challenges, then there are no challenges, because you look at these gentlemen and you know where I'm coming from. Look at this gentleman. He just bought a bike and he goes biking all over the city. And he comes back and he sends me videos of his biking expeditions. He is so well tuned into everything about food and everything else that he's like a man I can sit with. And he's got like a whole host of knowledge and skills and things I can just learn from him. So if you're talking about challenges, there are no challenges here. So if there are things that I look at in my everyday life, it is people who come in with, some poor oral hygiene. Sometimes some senior patients may have a lack of motor control simply because they are on some medication or things like that, or simply because they're just older, or just maybe an age-related thing. Then very frequently, of course, I see loss of teeth. And I think loss of teeth, poor nutrition, tooth decay are all interlinked and related to each other. So if there is a loss of teeth, obviously your nutrition is going to be very poor. And because of that, the oral hygiene is really poor. And then there's existing teeth end up having tooth decay. And that probably leads to some kind of gum diseases. And if one particular thing is taken care of, everything else just falls into place and it becomes really easy to handle your oral care in an everyday, thing. So there are other situations like a chronic disease. If I have a patient who has diabetes, or patients with blood pressure, or patients who have renal problems, these are the kind of patients who are on some long-term medication. And these long-term medications can sometimes cause things like a dry mouth, or they can cause, the swelling of your gums or things like that. But again, if these are the things you're facing because of some underlying medical conditions or some medication that you are on, it's very easy to handle it. And as we go along, I'll discuss a couple of things. So you'll know that dental care can be really inexpensive if you're just a little more careful, and if you find the right dental provider or a dental surgeon who's like a part of your family and can take care of everything that you need in your day-to-day life. Or something like this. Now, this is just pure neglect. If a patient comes in and when you look at this and I say, why are your teeth like this? So it's a thing. Or I don't really need my teeth. I'm kind of managing with my teeth. I can eat really well. I'm having no issues. But there are issues, because then some of his family members will say, oh, he can't chew his food. And in about 2 sittings, we can rehabilitate the patient completely like this. And it doesn't really need much. I don't need too much to do something like this. And it's really, really simple. But if you look at the before and the after, you'll see that there is a complete rehabilitation. All the tooth structure has been completely taken care of. And now functionally, these teeth perform better. If you're eating better, your nutrition is better. There are no underlying conditions like constipation or indigestion and things like that. And you just realize that it can be so much simpler enjoying your everyday food, which a lot of people who have teeth take it for granted. But when you realize when you don't have teeth, these things can be like a really big suffering. Or somebody like this, where a lady comes in and I ask her, how do you even eat food? And she says, oh, I've got my right side to eat on, so I'm just managing with my right side. But if you're just managing with your right side, then very soon the right side is going to give way because it's taking all the load. And this is just a case of here again, this is a very common situation I see in my practically every second patient who comes in my senior lot of patients looks like this. If you look at this patient, the patient just seems to have all his teeth. So you say, oh, what's the big deal? Patient's got all his teeth. But look closely at those teeth, because all these teeth have like a completely flattened out tooth surface. When you have a flat surface, your chewing capacity is almost zero. And when there's no chewing capacity, even if you have all your teeth, but you cannot grind your food, then you have other situations like you're not able to digest your food, digestion takes that much longer, hard food is a problem, soft food is a problem, everything is a problem. But something like this can be restored so easily, but just a couple of fillings and you're completely taken care of. So these were damaged teeth with flattened chewing surfaces. Now, if you look at this gentleman here, he looks very young, but he is an older patient. And he looks relatively happy. His whole existence, if you look at his aura, he looks really very happy. But let's look at what's happening in his mouth. Look at that. He has absolutely no teeth on either side. His upper side, he has no teeth. His lower left side, he has no teeth. And when we ask him how he was eating, the answer is always the same. Oh, I'm managing. It's not a problem. I can eat everything. So when we evaluated this case, if none of his lower teeth were in a condition where they could be salvaged, because he had a really, really poor underlying gum condition. All those teeth closely, if you look at them, the gum condition of all these teeth was in such a bad shape that none of these teeth had any support. All the teeth were like, they were moving, they were rocking, and he was happily managing with all of these teeth. But when we got around to doing him, we had to take off all his lower teeth, and look what we did for him. If you look at this here, these 1, 2, 3, 4, 5, 6, we had to place 6 implants for him. And after we placed 6 implants for him, we gave him like a complete supported prosthesis. And now look at his after. If you look at this, he's completely been rehabilitated. Now this patient is in a position to eat and drink everything. This case is almost about 6 years old. The patient hasn't come in once for a problem. If he's coming for a 10-minute routine check. But we have restored him to 100% functionality. And that is so great, because to do something like this, you don't really need to do much. It's one single sitting of implants. And after 3 months, it's just 3 or 4 sittings to get your denture screwed into place, and you're totally functional. So this is another way to do it. And this is what I prefer to do in my everyday practice. So looking at patients, getting them to rehabilitate themselves is also a little bit of an effort, because they will generally not listen because they're managing so really well. So a lack of nutrition, and these people come in with a really fragile and a weak physical appearance. Let me show you this case. This lady came in, and if you look at her upper and lower teeth, all the teeth were broken. There were no back teeth. She wasn't. So if you look at her, she looks like this really frail lady. And we ended up rehabilitating her with, look at this. This is her after. You can see all her teeth in her place. We did a lot of crown and bridge work for her. We did some veneers for her. We did everything that we could do. We did for her. And then she traveled back to Australia. When she came back a year later, look at that. She looks so different because she started eating well. She actually went and she put on a lot of weight. She looked more confident. She was happier. She started taking better care of herself. And that was so fascinating. And when she came in, I told her, Marilyn, you don't look frail anymore. She said, oh, you can't imagine, I'm eating so well. And then I think she went back and she realized she put in a lot of weight. So she came, when I saw her the year later for her next holiday, 3 years later, she had gone back to her frail looking appearance, but not because she's not eating, just because she started to exercise and she started to work out. So just a little bit of care and just a little bit of, doing stuff for patients just makes like a whole lot of difference in their lives. And that's the way it should be. And typically that's what I normally push my patients to do, so that they, in the long run, they are taken care of, they are rehabilitated orally, and they can take care of themselves. And this is when she came back. So she comes back every year, and I have a picture from every year, and you can see the work is stable, looks very good, and she's just looking happier every time she comes in. Now, I had this lady who came in, and she was referred to me because she said, oh, I've been sent for implants and all my teeth are moving and they're looking bad. And somebody told me I have really bad gum condition. So everything needs to be extracted and I need a whole lot of new implants. We took one look at her and I said, you know what? You don't need extractions. But if you're game to go in for orthodontic treatment, then we'll do orthodontic treatment and we'll save all your teeth for you. And she said, yeah, I'm game. And she is a senior citizen. And at that age, she was happy to do orthodontic treatment. Of course, now we have a lot of advanced orthodontic treatment. We don't like do braces. We got something called aligners, which work beautifully. And she said, yes, I'm game. Let's do it. We did 3 or 4 months of aligners for her. We aligned all her teeth for her. And whereas she had actually come in for a whole mouth of implants, we ended up doing only 2 implants for her, and we actually salvaged all her teeth. Now, that also happens to be a part of my specialization because I'm a restorative dentist and I'm an endodontist. So we could salvage all her teeth with just aligners, basic orthodontic. So the question here is not what we did for her. What I'm trying to say is I have a lot of patients who come in, senior citizens, and they, like I said, senior citizens are my favorite lot because they're just getting younger by the day, and they are more enthusiastic to do everything else that my younger patients are not willing to do. So that's how we rehabilitated her, and that's the last appointment we had with her when she was leaving. And she was just absolutely so thrilled. You can see her face is all alight and very happy. A lot of times we see people like this where you can see that now this guy has got a couple of teeth, he's got a few upper teeth, he's got a few lower teeth, and he's managing. Somehow people just always, food eating is such a basic natural necessity that everybody manages, but managing it with perfection is what we're looking at. And when you look at stuff like this, there are situations where none of these teeth were salvageable, so they needed to be extracted. But when I extract these teeth now, a lot of times in the earlier times, actually, we did a lot of dentures. A denture is basically, where you're putting in one upper denture and one lower denture, and then it's taking care of all your eating and chewing. But times have changed. And if to put it in really a brief, precise way, dentures basically sit on your soft tissue. They're sitting on your gums, they're sitting on your soft tissues, and the entire support is coming from that area, which basically means that as time goes by and you get older, the soft tissue is also going to degenerate, and it's also going to wear out, and it's also going to get weaker, which means that the fit of the denture is going to get poor. But if the fit of the denture gets poor, which means when you're older and you actually need to eat well, you're not able to eat well at all. So in that situation, if you absolutely must have a denture, then I have some instructions for denture wearers over here. But what we normally like to do today, what I prefer, or the whole percentage of dentures, pure dentures in my office is almost like just about 1%. Because what I prefer to do now is, place one implant here and one implant here. And with just those two implants, the denture just clicks onto the two implants. So now the denture is taking support only from the implants and not from the underlying tissues. So even if your gum and your bone recedes or wears out over a period of time, it doesn't matter. The fit of your denture is not going to get spoiled, or it's not going to be uneven, or it's not going to be poor, leading to a mobility of the denture, because your whole denture is just sitting on those two implants, and whole support is coming from those two implants. And like I showed you a case earlier, here I have multiple implants, but the denture just clicks onto the implant. So the denture is now sitting on those implants. So this is what we call an implant supported denture. And as far as the costing goes, implant supported dentures are not expensive at all, because it's just they're not expensive. If you compare the costing of an implant supported denture vis-a-vis the quality of life it gives you over the next, maybe say 15, 20, 25 years, the quality of life and the costing, there is no comparison there. So it just makes your life much easier, because as time goes by, if the motor skills are slightly, you're getting a little incompetent with the motor skills, all you need to do is click the denture on, and your eating and all is not compromised at all. And here, this is one of my patients. If you look at him, he came in with absolutely no teeth. And this is how we rehabilitated him, giving him a completely young, natural looking appearance. Or we have somebody like this who came in, and she just needed a lot of restorative work and a lot of endodontic work. But the point is, just getting to manage or just managing and letting it be is not the way ahead. You really, really need to go ahead and make sure that all your teeth are taken care of.
I'm very thankful for Dr. Jaggi.
Feedbacks of our patients, and you can see this lady here.
My name is Padmini Ishwaran. I come.
So again, same thing here. A lot of patients who come in with missing teeth, broken down teeth. Coming to what I do as a specialist, I mean, like Pradhiman just mentioned, I'm a microendodontist and a restorative dentist. Microendodontics basically means that I work with a microscope, which is what it's called a dental operating microscope. So the dental operating microscope typically is something that enhances my vision to a very large extent. And the microscope has 6 levels of magnification. So to put it in really simple terms, if I'm looking at a strand of hair, just looking at it visually, and if I'm looking at it under a microscope, the strand of hair will look as thick as my arm. So that's the level of magnification I'm looking at. Now, if I'm looking at that level of magnification, every little thing that we're looking at is highly magnified, and it's very blown up, and it makes treatment non-invasive and absolutely painless. So Now these are.
I come to Dr. Jaggi, you see.
So
here it's foolproof.
Who've come in during the COVID times, and we worked on them, and they have been very happy with everything we did. So coming down to how do you even take care of stuff, or how do you manage basic things that are taking place? Now, these are things that I would also give advice to a younger patient, but these are more specific to my slightly more senior patients, because when you have a small little thing that needs to be addressed, just do it right away. Because I've realized that as time goes by, my slightly senior patients find it difficult to sit for longer hours in the chair. They're not very happy with complicated procedures. They're not very happy with things that take too long. They're not happy with things that are painful. So these are the things that I've eliminated in my everyday work. And I've made sure that these patients, when they come in, when I'm dealing specifically with a senior citizen, I make sure that I make them extremely comfortable to start with, because the way they sit, some people have a spondylitis problem, somebody has a back problem, a neck problem. Make sure that you ask your provider. I mean, if I see my patients, we make sure we do it. But if you're going to your dentist and you really don't like going to the dentist, nobody does. But ask them for a pillow if you have a back problem and things like that. Make sure that you understand the treatment that's being done. Make sure that the protocols are non-invasive. If something can be saved, please ask them to save it instead of just extracting it. Because remember, adapting to a new denture or adapting to a new thing is extremely difficult. Unless it's an absolute must, it should be avoided. So if you're looking at tooth decay, make sure that by the end of your restorative procedure, by the time your dentist finished with his work, you have like a good fluoride or varnish that's been put on all your teeth, because fluoride to a large extent prevents decay of any kind. So you're into preventive or rehabilitative work. Also, when you're doing an everyday toothbrushing, make sure you use a good fluoride toothpaste. Regular and routine checks, that's one thing a lot of people take a lot for granted. But I make sure that my patients, typically, if you have a gum problem, make sure you visit your dentist once a month. Yes, when I say once a month, I mean once a month. Because, till you don't have a pain and you don't have a problem, you're just taking everything for granted and you think there's nothing wrong. But the second your dentist assesses it, and if there's even something going minusculely wrong, it becomes very easy for them to just rectify it at that point instead of waiting for it to get worse. And once a month is good. If it's not a gum problem, once in 3 months is perfect. All your work has to be done in an absolutely minimally invasive fashion. Gone are the days of extractions and replacements and crowns and bridges. Ask for implants. Ask for minimally invasive dentistry. Ask for microscope enabled dentistry. Ask for magnification enabled dentistry, because all of these things, if your dentist is working with these things, then you know that they are on to the next level of work, which means your work is more precise, which means your suffering is a lot less, for sure. Okay? A lot of medication, if somebody is on a medication, then it leads to dry mouth. And dry mouth is something that it's extremely unpleasant, because we take our saliva for granted again. When we're talking, when we're communicating, it's very easy to do it because your saliva is actually acting like a lubrication agent in your mouth. But if you're on some kind of medications for renal disorders, stomach disorders, diabetes, it can actually dry your mouth out to a very large extent, in which case hydration is very important. It may be a good idea to have a small bottle of water and sip it regularly. If that's not a thing you want to do, you get a lot of these oral hydration solutions in the market. But again, you need to keep using them all the time. Please remember that typically, if you have a dry mouth, you are extremely prone to a lot of decay and caries, for the simple reason that, again, saliva is something that acts as a cleansing agent. If it's constantly cleansing out your mouth all the time, then it's cleaning away all the food, all the plaque, everything is getting cleaned out consistently. But if you have a dry mouth, everything is just sticking onto your teeth, and then it's leading to the next level, and then there's decay there, and decay is typically going to lead to breakdown, it's going to lead to advanced dental work. So another way to deal with dry mouth may just be sugar-free gum, which you may want to chew on, because again, when you're chewing on sugar-free gum, it actually enhances the salivation to a certain extent. So that can be another way you can deal with the dry mouth and make it easier for yourself. Now, if you have gum disease, and like I said, if you have gum disease, you need somebody called a periodontist. But a periodontist is typically a gum specialist. But even if your dental surgeon is a good non-invasive dental surgeon, then make sure you get routine cleanings. If a gum disease will typically lead to something called a dental pocket, which means that between your tooth and your gum, you're going to have a deep pocket. And if you have food lodgement getting stuck in that area, then it becomes very difficult to clean that area out. So when I just mentioned in the last slide that if there is a gum disease, then an evaluation once a month is a very good idea, because if there's something that's going wrong or not looking right, it's very easy to fix it in a month's time. But if you're going to wait for a year and go back, it might just get really worse. So if you have to prevent gum disease, make sure you brush your teeth twice a day with a fluoride toothpaste. Make sure you floss regularly. Now, for a lot of my flossing is very easy if you're using a dental floss, but it can be a little challenging sometimes because the floss is a little difficult to manipulate. So in which case, I want you to use something called a water pick or a water flosser. I have a video here for a water flosser. I will show it to you in a minute. So the water flosser is something you can use because it's just a reservoir with water filled in it and a tiny nozzle. So you just keep it between your teeth and you squirt. So the water goes through and cleans your teeth out completely. So that's a brilliant way to keep your teeth clean, and it doesn't need too much of manipulation and super simple to use. Visit your dentist routinely for a checkup and a cleaning, and please inform them about any medical conditions that you may be having. Well-balanced diet is an absolute must. Smoking, I have to mention, is an absolute no-no, because smoking increases your risk for gum disease if you already have gum disease. And if you don't have gum disease, smoking will generally cause your peripheral blood vessels to become very small, which means the amount of blood going to that area is very little. And it's very easy then for the bone to get damaged and start going bad. So smoking is an absolute no. Okay. Now, what is the right way to clean your teeth and your gums? So gently brush your teeth on all sides. Now, these are basic instructions, but they need to be followed. Again, if just brushing is becoming difficult, then it's a good idea to pick up a motorized toothbrush, an electric toothbrush. All you need to do is put it on and leave it on each tooth for about 2 or 3 seconds and then go on to the next tooth. So typically what you're doing is you're not using your hand too much to do all the movements for the brushing, but the electric toothbrush is taking care of it. And the electric toothbrush again is a great aid if you have if your motor skills are not that good, or if you're not able to get into a particular area, then an electric toothbrush it is, which you must use regularly. Okay. Again, if you have a situation like this where you are not able to hold the brush really well, you might want to just stabilize it with a little elastic band, which makes holding it much easier, and you're able to clean that area. So that's another way to do it. And this is typically for patients who might have slightly compromised motor skills, tremors in the hand, or not able to hold the hand steady for a longer period of time. This works beautifully. And if you're using it, this with an electric brush will make it much easier for you. Okay. I have a link here for a water flosser. Let me just finish and I will show you this link. Now, this is one statement that I'm making. I know it's not a great statement, but sometimes badly done work is the biggest offender. Now, what I mean by this is, sometimes you go to your dentist and you have a problem, and because you can't take a very long appointment and you can't sit for too long, so you might end up getting like a transient or a stopgap arrangement treatment where it's like, let's just do this now and then we'll see later. That's a really bad idea, because if you're doing something, it should be done optimally, because remember, this is what is going to last you for the longest possible time. If it's something that you're just doing for like a stopgap arrangement or something, if it means doing implants, then you go all the way and do the implants, because like I said, whatever you do and stabilize, it just stays like that for the next many, many years. So try and avoid, interim procedures, which are just like temporary procedures. A temporary is never good enough. You always need something that's going to take you all the way. So these are my senior citizens, where you can see all of them look relatively happy. They've undergone a whole lot of rehabilitation that I've done for them, and they have been taken care of. And I will leave you here. So again, that's my team that I work with. And that's how it works, because when I'm doing such complex procedures and I'm making sure everything's taken care of, you need a huge team to help you with. And that's my number, and that's my email ID and my Instagram handle. Any questions? I'm very happy to answer everything. I'll be very happy to discuss everything. And yeah, this is the way ahead. So no stopgap. So to conclude, no stopgap treatment. Everything has to be done to perfection, because remember, what you do now when you're physically fit and you need something that needs to be done 10 years down the line, it's going to be a problem, because you may not be that physically fit and you may not be able to take it. So when you're doing something, go all the way and make sure it's the perfect thing to do. So thank you so much. I hope it's made sense, and I hope you all have enjoyed what I've just said.
Absolutely, Dr. Jaggi, this has been amazing. You know, I must make this remark. It's amazing that we have, let me just get your screen off. 1 second.
Should I stop share?
Stop the screen now. So we will have, of course, have Dr. Jaggi's coordinates on when we publish the takeaways on Monday. So those of you who've missed it will be able to see it, as well as the video, the edited video of this session, yeah. And the takeaways from this session will be there. Takeaways written by a qualified doctor, so it's not just some journalistic effort which is there. Yeah, Dr. Jaggi, I was saying that, you know, it's interesting that I have we have a doctor like you know, other than your phone number and email address, also giving your Instagram handle, and you know, that's perhaps the way to go. And especially, I guess, because you are dealing with cosmetic dentistry, etc. That is important. Okay, so we have quite a few questions that have come in. I will. We are at 5:38 as we speak. I will take a few questions that have come in, which are different. So we have a question from Mr. Narendra Advani, who is 67. He says he's got 2 implants done in his left lower and upper left side. Crowns yet not fixed. Can I get implants done on my right lower side now before the crown for the left side are fixed?
So if I understand right, he's got crowns on upper one side and the lower opposite side, right?
Crowns are not fixed yet. He just got the implants done.
Implants, yeah. So Mr. Advani, right?
That's right.
Yeah. So what I'd like to tell him is, you know what? It's a great idea to have all your implants placed simultaneously, because when the loading of the implant happens, your dentist will actually balance out the whole bite for you. If you're doing implants and crowns piecemeal at different times, your occlusion, or what we call the bite, might end up being like top and bottom. But if you do all the implants first and make sure all the crowns come together, then you'll have like an absolutely perfect optimal bite. So yeah, please go ahead and get those implants placed, even if the crowns are not fitted.
Right. Thank you. We have a question from Mr. Shankar Chavan, who's 82. And he says, nowadays, cutting the root of the teeth has become common to treat patients suffering from toothache. Is it advisable for common toothache?
So
actually, you know, I must have this. I have another question around this. In the good old days, if I would go to a dentist, you know, he or she would say, "Chalo, cavity bhar do," right? But now it's almost on a regular basis. It's a root canal job. So is this a new trend? Is this that you fix it at the roots, or you know, what is the thing? I guess that's the question that he's also asking.
Yeah. So let me answer that for you. Let me start by saying that today the trend in dentistry has changed completely. We are talking about non-invasive dentistry and biomimetic dentistry, which means that every tooth for a root canal is a really bad idea. So like I just mentioned a little earlier, you know, a good radiograph, very often, if it's done well, and 80% of the times, if your nerve is not already involved, a root canal happens only if the nerve is involved. If the nerve is not involved, you don't need a root canal. So fixing the cutting of the nerves for every case is an absolute no-no, because cutting off the root for every tooth means a root canal, and a root canal comes with a lot of perfection that needs to go into it. So that is something a specialist should be handling. And no, every tooth does not need a nerve to be cut. Basically, most 80% of the times, a good filling will take care of everything.
A good filling will take care of everything. We have a question from Mr. Bharat Mehta, who's 65. He asks, and this is something that you addressed in your presentation, but still, my question is, what precautions do senior citizens have to do to make teeth strong?
To make teeth strong, one, like I said, teeth, like any other structure that you create. So, if you look at a building and a building has a weak foundation, it's not going to stay for too long. So if you have a tooth, make sure that whoever your dental surgeon or your provider is not an aggressive dental provider. If you got a tooth that's broken down, doesn't mean that the tooth needs, you need a crown and you need everything else. The whole trend of dentistry, I'm going to put a link in for something called biomimetic dentistry, which means preservative dentistry. It means that no cutting and chopping, more saving is what people should be looking for their providers, and which is what we do to a very large extent. We're totally biomimetic and preventive and minimally invasive.
Doctor, how do I know that this dentist is aggressive or not? As a designation to the likha nahi hai na? Some 3-star, 5-star, okay, aggressive, non-aggressive.
So that's why I said I will put down a link for basic things to look for. I can't say that this person is good or this person, but what you should be looking at is people, like I said, if you have a provider who's using magnification in the form of a microscope or dental lobes, that means that their vision is a lot more enhanced. That means they can see a lot more and they can preserve a lot more. I think you start with that premise, that where every tooth is not a tooth for a crown or every tooth is not a tooth for a root canal. I think that's what you should be looking for. If you think the protocol is looking too aggressive, then maybe you need a second opinion.
Right.
And this is just an idea, because I mean, very frankly, where I'm coming from is I've been working, like I said, for almost 28 years now, and I have a highly specialized practice. And you're not going to believe this, but about 85 to 90% of my work is only redoing old, badly done work. I mean, they have work that's been done by somebody else, and I'm only sitting and repeating it, where the patient ends up paying more, a little bit more, because now we are changing everything and repeating everything only because certain protocols and principles weren't followed. Dentistry is like maths. 2 plus 2 is 4. 4 plus 2 is 6. There are principles that govern the whole thing. It's not just because you got a drill, you just start chopping and cutting the teeth.
Doctor, we have a question. So we, by the way, our audience is very alert. So we have Katie Dadanchi, who's one of our regular, who's regular in these sessions. He says, Doctor, you were to show us the water treatment which we can use instead of flossing. Please show us what it looks like.
Yes.
And how we can use it.
For 1 minute. I'm just going to see if I have it on my screen, because I had a link for it on my presentation. Let me just pull up that link, and it's like a YouTube link. I will just 1 second. Just give
and
me
what does it cost? What does this water flossing cost?
Yeah, I'll tell you that also.
Yes, I reached 1 crore yearly income. I was super sad to hear.
Just 1 second. We need to share the screen now.
Can I just share the screen for a second again?
Yes, you can. You can. Yeah, go ahead.
Is not enough. If you just brush, food and debris get left behind. The Waterpik Water Flosser is the easy and most effective way to clean between teeth. To get started, follow these simple steps. Fill reservoir with warm water and place firmly on the base. Select a tip that's right for you. Click firmly into handle. If this is your first use, you'll need to prime the pump. Number 1, set the pressure control to high. Number 2, point the tip into the sink. Number 3, turn on until water flows. Number 4, turn unit off. Now let's get on to water flossing. Start with the lowest pressure setting. Lean over the sink and place the tip in your mouth. Turn unit and water on. Partially close lips to prevent splashing and let water flow from your mouth into the sink. Aim the tip at the gum line. For best results, start with your back teeth. Move along gum line, pausing briefly between teeth. Floss front and back side of teeth for 1 minute a day. The Waterpik water flosser removes up to 99.9% of plaque from treated areas and is up to 50% more effective than string floss. You can have healthier gums and brighter teeth with the Waterpik water flosser.
Great, that sounds good. So I'm looking at the one of the e-commerce sites, and I see that there are two ranges. One is somewhere around 1,500, and the other is around 7,700.
Yeah, so this is what I was coming to. I put up a thing for Waterpik because Waterpik is one of the most. Can I put the screenshot off?
Yeah.
Okay, so I did demonstration with Waterpik because Waterpik is internationally recognized and it's one of the best water flossers available in the marketplace. But it also comes with the premium price tag. So there are a lot of other Waterpiks that are available. I will share a link. I can send you a link which you can put up for our viewers.
So I'm actually looking at the Amazon website, and there's a
CareSmith.
Waterpik.
CareSmith.
There's a Waterpik which is for 1,423.
Yeah.
And
So
there's
now
a Waterpik for 7,767.
No. So again, there are some ones which are really shitty. They're really bad. So I will give you a link for something called the CareSmith water flosser. I've had a lot of patients use it and it works brilliantly. Costs about $1,600. And worst case situation, even if it stops working after about a year or two, you can just chuck it and get a new one. So you're not stuck with an expensive water flosser where you're getting it repaired and things like that. So the CareSmith water flosser works brilliantly, and I think it's about $1,600 odd.
It's around. There are two options. There is one professional, and the other is one cordless. One is for 1,800 with GST, and the other is for 2,000.
Yeah.
Great. Sounds good. Doctor, I have a question which is there for you. Just as you have blood work that you can do to assess if there are any signs of problems that are there, but with the teeth you don't really do that, because if there's a pain, if there's some numbness, etc., then that's when you get to know. But is there something that you would advise our seniors to do on a regular basis?
Like I've emphasized right from the middle of this presentation, ever since I came to that taking care bit, going to your so again I keep coming back to the same thing again. You have to find the right provider who's focusing more on preventive dentistry rather than just wanting to look at a chief complaint. So what's a chief complaint is basically you come to my office, I say, oh, you got a hole in your tooth, I need to fix it. I do that and then you're out of my office. But you need to find a provider who's a holistic dentistry provider, where when somebody walks into my office, we don't look at the chief complaint at all. We look at everything else first and make things that are in the process of going bad or are likely to go bad. We document those findings and take care of that first, because the chief complaint is something that already needs work, right? But if I'm into preventive work and I look at stuff that I say, oh, I know this is going to go bad, let's just fix this first, then I'm just saving the patient a whole lot of trouble. And everybody complains dentists are super expensive, but then this is a really cheap way of doing dentistry. If you're looking at some tiny things that need to be handled and preventing dentistry from the dental problem from getting worse, then they don't pay anything for it. It's like so simple. So coming back again, when I look at a patient, when I examine him, I do it with a microscope. So even the tiniest little bit jumps out at me and I say, oh, you got something there. And the patient says, oh, I can't see anything. So all my microscopes, I mean, if you look at this here, you'll see there's a screen there's a screen on the top. And if you look at this thing here, there is a microscope hanging there. So this microscope is now connected to a screen. When I'm watching, what I am watching, the patient is looking at on the screen. So it becomes very easy and foolproof for me. I don't have to say, oh, you need this done. The patient looks at it and say, oh, doc, I can see something there. Don't we need to fix it? So I'm not selling dentistry at all. The patient is looking at it and saying, oh, I understand what's happening and it needs to be fixed. The thing here, the most important thing here is your provider needs to give you that little bit of time to assess you 100%. And he or she has to be using some form of magnification, which makes vision that much better. With a combination of these two, there's absolutely no way that you're going to suffer with any long-term dental issues, because most of them get taken care of in that very initiation or incubation phase.
Tell me something, since you raised this, and it's a very interesting topic, but how many people who come to you, actually come to you, hey doc, I've come here for my annual checkup. Now, just check my teeth. Do you have people doing that, or do you have which you may actually go for your blood work, your ECG, and a variety of things which you do as a routine? But how many people actually come for just a routine dental checkup?
So actually, now plenty of them, because I've got this whole thing of a 28-year-old practice. So we put the thing into trend. Whenever we see somebody, we make sure we are seeing them every 3 months. So my office calls them, they get their emails, they get their messages. It's like a complete computerized ecosystem where everything is digital, and they get, so even if they don't get back to me and answer it, somebody from my office will follow up. So we just traumatize the patient till the patient has to come and look. But between my Indian patients and my foreigners, the foreigners are more particular about everything. The Indian patients will sit on it till it gets worse. And then, but like I said, that trend is now changing, because we've set out an ecosystem where the patient comes in and says, oh, I didn't get a call from your office last month. I was supposed to come in for my 3-month visit. So now we've trained them to do it, because we started the trend. So we train our patients so that they are tuned and acclimatized to coming in every 3 months.
Every 3 months, huh? 3 months is what you recommend.
3 months is what I recommend, because I do a lot of preventive work. So if I see something even minor, we catch it right there and take care of it.
But is there, I am aware of this entire dental X-ray that one can do. Is that something that you would recommend? Somebody would just go take a dental full job?
No, not routinely. If I'm doing like a major rehabilitation or a renovation thing or whatever, then I will. But not like a routine thing. I wouldn't send them for a complete thing, because they are being exposed to radiation. Unless I don't absolutely need it, I'm not exposing them. What my eyes and my clinical judgment can do, the radiation definitely doesn't need to do.
Interesting. Thank you very much for this amazing session. A lot of issues which we haven't done so far. And thank you again for your time. This is Seniors Today, and you're watching Health Live at Seniors Today with Dr. Shail Jaggi, who is, in fact, you are the first doctor who has joined us from Pune. And so welcome to all our audience in Pune and Mumbai. You know that it's Dr. Jaggi is just an expressway ride away.
Guys, how many people I have who come in from Bombay very routinely, by the way. I have people who say, oh, if I drive to somewhere else in Bombay, it takes me 2 hours. It takes me 2 hours to come from Bombay to Pune. So this is drive into Pune, and they say, oh, we take a holiday, we finish our dental work and we go back.
Well, it's a little more than 2 hours, with the traffic in Mumbai as well as in Pune. But great. Thank you very much for this session. And, for all of you who were here, we are, you are aware of the fact that we've completed 3 years right now. The 3rd anniversary issue of Seniors Today is out, and it is available free of cost on seniorstoday.in. We are starting our 8th season of Seniors Have Talent on August 17th. That is soon after India celebrates 75 years of freedom, of independence. And we will have the 8th season of Seniors Have Talent starting then. Dr. Jaggi, you must watch it. It's amazing.
Wow.
All 60-plussers, and they are singing away. And
Wow.
It is so therapeutic. It is therapeutic for even somebody like me, because, you watch it and you really enjoy it. So that's been happening for the last 2 years, and we've had 7 seasons so far.
Awesome.
And of course, every day there are some sessions that we conduct on Kabir, on storytelling, and the like. So that's how it is. And keep watching, the various things that we are doing with Seniors Today. And we will be back again with the next session from of Health Live at Seniors Today. And thank you very much, Dr. Shail Jaggi, for being here.
My pleasure. And I'm going to send this link to all my senior citizen patients who are here in Pune. So I'm sure you're going to have a lot of people logging on and checking you guys out.
Thank you very much. I will send you the link of the takeaways when we are up on Monday. Thank you very much.
Thank you. It was a great session.
Subscribe now and press the bell icon. Never miss an update.